the University of Ottawa Department of Anesthesiology Competency-Based Residency Program, we developed a series of online learning cases to help residents achieve the defined milestones and entrustable professional activities, or EPAs, required of anesthesiologists. These self-directed learning cases have replaced the Royal College's mandated core academic half-days. The benefits of the learning cases over a lecture-based approach are threefold. First, what residents learn is directly related to the module they're currently in, and not a predetermined lecture schedule. For example, during the pediatric module, residents will only complete learning cases related to pediatric anesthesia. Second, the cases are self-directed, so they can be completed at a time convenient to the resident. Residents can log on whenever and wherever they want to study. Lastly, the cases are discussed individually with a staff physician, allowing one-on-one learning and assessment. By studying the topic before the interaction with staff, the staff-resident discussions can be at a much higher level, mirroring a flipped classroom. So, how does this learning case platform work? When staff and residents log in, they are presented with a list of all the cases, organized by stage of training and then module. The list can be collapsed and expanded using these buttons, or by clicking on the stage of training or module name. Residents can see which cases they have completed and their overall progress. Clicking on the case title will open the case for both residents and staff. Cases are based on the format of the Royal College oral examinations. Residents are provided with a case scenario, followed by questions to direct their learning, as well as carefully selected resources such as journal articles, textbook chapters, and videos to support their learning. Residents are expected to spend about an hour engaged in self-directed learning for each case before meeting with a staff anesthesiologist to discuss the case and be assessed. When staff access the cases, not only do they see the case description and questions, but also a description of the level of competence residents are expected to demonstrate during their discussion of the case. Once the resident and staff finish discussing the case, the staff assesses the resident by clicking the Assess a Resident button at the top of the case. Staff are to indicate which case is being assessed, the name of the resident, the date of the assessment, and whether or not the resident demonstrated the required level of competence for the case. If not, staff are to indicate what residents need to improve on before re-attempting the case. Once the assessment is complete, the assessment is saved and becomes part of the resident's record. Residents are expected to complete all required learning cases before the end of each module.